safety is, fo- is focused on protecting the welfare, health, and safety of individuals who are employed or working. Its main objectives are to promote a safe and healthy work environment for employee and to prevent accidents, diseases, and injuries in the workplace. Next one is compare and contrast employer and employee obligation. First one is employer obligation. Employer and employee have responsibilities regarding occupational health and safety to ensure a safe work environment. Employer must provide a safe workplace, including proper ventilation, lighting, and equipment safety. They must conduct regular risk assessment to identify potential hazards, provide comprehensive training and educational safety procedure, hazards identification, and emergency protocols, and, and PPE. Employer must also comply with all relevant regulation and standards, which may involve regular inspection and audit to ensure compliance. Next one is employer obligation. Employees are responsible for adhering to safety policies, reporting hazards, promptly participating in a training program, and following safe work practices. They must use the provided equipment correctly, follow established procedures, and avoid shortcuts, compromising safety. Employee must also cooperate with investigation conducted by the employer or regulatory agencies, providing information, participating in interviews, and adhering to confidentiality requirements. These obligations ensure that potential risks are addressed and mitigated before accidents occur. Next, we'll continue by Harleen Kaur.
Hello everyone, my name is Harleen Korvik and my student ID is 131188237, and I'm going to continue with the topic comparison and contrast. First one is legal responsibilities. Both employers and employees have legal obligations to ensure occupational health and safety. However, employers have a high level of responsibilities as they are legally mandated to provide a safe working environment, while employees must comply with established safety protocols. Second, resources provision. Employers are responsible for providing resources such as training, equipment, and safety protocols, while employees are responsible for utilizing these resources correctly. Risk assessment. Employers conduct formal risk assessment, while employees may contribute to hazard identification through their daily observation and experiences. Enforcement. Employers enforce safety policies and regulations while employees must adhere to them voluntarily. Consequences. Employers may face legal consequences for failing to meet their obligations, such as fines or lawsuits, while employees may face disciplinary action for failing to comply with safety policies. Next slide. Why is this topic a human resource management issue? Occupational health and safety is fundamentally human resource management issue due to its direct impact on employees' well-being, safety and productivity within organization. Here's why. Employees' well-being and morale. If their occupational health and safety measures create a safe and healthy workplace, enhancing employee satisfaction and engagement. Second is legal compliance and risk management. HRM is responsible for ensuring that organization complied with all relevant laws and regulations related to employment, including occupational health and safety standards. Third, recruitment and retention. Workplace safety and health practice can significantly impact on organizational ability to attract good and talented staff. Next is absenteeism and turnover. Unsafe working condition can lead to higher absenteeism rates, employees turnover, and reduced productivity. Workplace culture and employer relation. It it affect A lot because it leads to develop job skills, knowledge, and competencies. And next is cost management. Workplace accidents and injuries can have significant financial implications for organization, including medical expenses, worker compensation claims, and potential litigation cost. Next, Rajdeep will continue.
Hello everyone, my name is Rajdeep Kaur and my student ID is 165236225, and I will be discussing the impact of COVID-19 on healthcare, health and safety. Global health and safety practice have been profoundly affected by the COVID-19 pandemic, especially concerning the usage of personal protective equipment. There are the few important aspects that I am going to talk about. The first is increased demand and shortage. The surge in demand of for personal protective equipment due to COVID-19 overwhelmed supplies chains, leading to shortage worldwide. Healthcare facilities, in particular, face difficulties in acquiring adequate PPE to protect their staff adequately. Here, I would like to share one of my example. When I was working back in my country, I was working in a COVID ICU, and we were getting the limited stock of N95 masks that was like 5 masks for a month, and it was very difficult for us to use that adequately. And because we were working in ICU, and there was the risk of infection was so high, so this kind of problems we were facing during the COVID-19. So the next point is extended duration of PPE use. With PPE shortage, healthcare workers were often forced to extend the use of PPE beyond its intended duration. As I've discussed in previous point, this was the problem we were facing. And the next point is inappropriate PPE use, reuse. In some cases, due to shortage or lack of access, healthcare workers resorted to reusing designated uh, designed for reuse. Practice increases the risk of cross contamination and transmission of infections. Next slide, please. The adverse health reaction. Extended use or inappropriate reuse of PP can lead to adverse health reaction among healthcare workers, such as skin irritation, respiratory issues, or allergic reaction. These reactions can impact both physical health and job performance. The next point is impact of sustainability of healthcare. The increased consumption of PP coupled with shortage of improper disposable practice has raised concern about the sustainability of healthcare system. So while working with the COVID-19, we have to wear the PPE kits, and there was a large amount of waste production of that kits, and the and transposal of those disposable of those ppe was a big issue which was faced by hospitals and other healthcare facilities. The next one is update to guidelines and improvement. Health authorities and organizations have continuously update guidance for PPE use based on evolving scientific evidence and based best practice improvement projects focusing on developing innovative PP solution, enhancing production capacity, and optimizing the distribution network to address shortage. There was the number of seminars was introduced so that we can use the PP properly and dispose them with the proper manner. The next point is impact on mental health and well-being. The stress and anxiety of working in environment with PP shortage, fear of infection, witnessing the impact on pandemic on patients can take a toll on the mental health and well-being of healthcare, such as burnout, anxiety, depression, and PTSD, and are among the challenges faced. And the last point is challenges in PPE compliance and enforcement. Ensuring compliance with PPE protocols, especially in high stress environment, present challenges, factors such as discomfort, fatigue, lack of training, and inconsistent informants contribute to non-compliance. Effective strategies including education, training, regular audits, and sportive leadership were used so that we can mitigate all these challenges. So the next topic will be discussed by my colleague Navkiran.
Hi everyone, my name is Navkiran Kaur. My student ID is 133039230. So I'm going to discuss the consequences of occupational health and safety. So here are some kind of consequences. Some are positive, some are negative. So firstly, I'm going to discuss positive consequences. First one is enhanced performance. In this, like sometime if we have a short-term deadline, so it can enhance the efficiency and focus of a person. Next one is heightened alertness. Like these kind of things can enhance the body fight and flight mechanism. So person can respond in different kind of situations very efficiently. Next is skill development. In skill development, they can it can foster the coping mechanism of the person, and they can properly focus on the task. Next one, problem solving skills. So in this there's some kind of positive consequences, like person can solve the different kind of problems by facing the challenges. Is either there is any change in the work, so to achieve their goal they can develop these kind of skills in them. Team cohesion. In this kind of consequences can build the bond between the team very effectively. Like they can when they can if they communicate together, so it they can change their idea, so it can build the connection of people together. So next one is adaptability. So it indulges a person the quality of adaptability. Like adaptability, in this person can adapt any kind of challenging situation. Last one is positive force. So it can enhance the positive forces in the person, like the way of thinking of the person, and change the personality of the person. Next slide, please. So next are negative consequences. So there are some kind of negative consequences. Like first one is mental health impact. Sometime if person is not properly capable to deal with this kind of stress, and he can face a couple of the mental health disorder like depression, anxiety, panic attacks. Next one is safety risk. So this kind of things, like if the person is not properly concentrate to his work, so he can get in trouble, he can get in contact with any accident. Next is high turnover. In this, in the high turnover, like in the on the organization level and in the bond between the person can feel different kind of problems, like how they can make the connection between others, how they can enhance the status of their organization and their own image in front of others. Next slide, please. Next is legal and financial consequences, which can faced by the both the employer, and the organization. In this, the person can like face the penalties and we fine from the organization, and it can also lead to face the reputational problems by the organization. Second last is physical health effect. If all these kind of circumstances occur, the person can feel different kind of situation, like a person can feel hypoglycemia, hypotension, and person can feel headache and muscles tension. And last is decreased performance because of the that effect of the health effect, mental health effect, and all the problems. The performance of the person can be decreased, and he can affect his image in the organization. Next slide, please. So the last one is summary. In this, like occupational health and safety is a vital human resource management concern influencing employee well-being, legal compliance, recruitment, retention, absenteeism, workplace culture, training, and course management. Human resource ensures compliance with regulations, foster a safe environment, and manages risk. Integration human and resource management practices into policies create a safer, healthier, and more productive workplace. Next slide, please. So the last are the references which we all use in our PPT. So thank you so much. If anybody have any question, you can